Hello. Today I will demonstrate you the extensor compartment of the leg muscles. So in the extensor compartment of the leg, we have four muscles. One is the tibialis anterior, number two is the extensor hallucis longus, number three is extensor digitorum longus, number four is the Peroneus tertius. And all these muscles are innervated by one nerve, which is the deep peroneal nerve, and the compartment is supplied by the anterior tibial artery. So I will demonstrate these muscles, their origin and insertion on the cadaver. So the extensor compartment of the leg muscles, the first muscle is this one. This is the tibialis anterior muscle. This is a spindle shaped multipinnate muscle. It takes origin from the upper 3/4 of the lateral surface of the tibia. It takes origin from the interosseous membrane and also the deep fascia of the leg. And when you see the insertion, this muscle, it forms into a tendon, and this tendon, it pierces the superior extensor retinacula and inserted onto the inferomedial side of the base of the first metatarsal bone, and adjacent sides of the medial cuneiform bone. And action of this muscle, it is a dorsiflexion of the foot at the ankle joint. It maintains the medial longitudinal arch. It acts as the inverter of the foot at the mid-tarsal and subtarsal joints, and the nerve supplying to this muscle is the deep peroneal nerve. So this is all about the tibialis anterior muscle. Next we have this muscle. This is the extensor hallucis longus. This extensor hallucis longus muscle, this muscle, it takes origin from the middle of 2/4 of the medial surface of the shaft of the fibula. It is a unipinnate muscle. It is medial to the extensor digitorum longus. So this is the extensor digitorum longus muscle. Medial to this muscle, you see this muscle. This is the extensor hallucis longus muscle. Insertion: the tendon runs forward along medial side of the dorsum of the foot and inserted into the base of the terminal phalanx of the great toe. This one. So it is moving on to the terminal phalanx of the great toe. This is the extensor hallucis longus, which is seen between tibialis anterior and extensor digitorum longus muscle. Nerve supply is, it is supplied by the deep peroneal nerve, and action is, it is a dorsiflexion of the great toe. Next we have the extensor digitorum longus, this muscle. This is the extensor digitorum longus muscle. This muscle, it takes origin from, this takes origin from the upper 3/4 of medial surface of the shaft of the fibula, from the interosseous membrane and also from the deep fascia of the leg. And insertion, if you see, the tendon passes beneath the superior retinacula, and on the dorsum of the foot, the tendon splits into 4 slips. You can see here 4 slips for the lateral 4 toes. Okay. The extensor digitorum longus tendon joins with the extensor digitorum brevis tendon. Now once, if I reflect these tendons, you can see deep to this, you see this muscle. So on the dorsum of the foot, this is the muscle which is extensor digitorum brevis, and this muscle is also ending up in these tendons. Yeah, you can see here. These are the tendons of extensor digitorum brevis. So this extensor digitorum longus tendons will join with this extensor digitorum brevis tendons, and ultimately they form the dorsal digital expansions at the proximal phalanx, and each dorsal digital expansion trifurcates into medial and collateral bands. The medial slip is inserted to the base of the middle phalanx, whereas the collateral slips will be attached to the base of the terminal phalanx. And action of this is, it's a dorsiflexion of the ankle, and also it's a dorsiflexion of the lateral 4 toes. It is supplied by the deep peroneal nerve. So this is all about the extensor digitorum longus. Next we have last muscle, this one. This is the Peroneus tertius muscle. This Peroneus tertius muscle, it takes origin from the lower 1/4 of the medial surface of the shaft of the fibula and inserted onto the dorsal surface of the base of the fifth metatarsal bone here, this one. And action is, it is a dorsiflexion of the ankle joint and acts as a weak everter of the foot. Okay. So these are all the muscles you see in the extensor compartment of the leg. I repeat, this is the tibialis anterior. Next we have the extensor hallucis longus, this one. Next we have this tendon, this is extensor digitorum longus. Then more laterally this tendon, this is the Peroneus tertius. Now here the nerve of this compartment, as I mentioned you, we have the deep peroneal nerve, this one. So here we have this nerve and the vessel. The vessel is anterior tibial artery. Between the tibialis anterior and extensor hallucis longus, we have this vessel. Yeah. This one. So this is the tibialis anterior artery, which continues onto the dorsum of the foot as the dorsalis pedis artery, and this artery is accompanied by this nerve. This is the deep peroneal nerve. So this is the nerve which is the nerve of this extensor compartment of the leg. This is all about the extensor compartment of the leg. Thank you.